Hi everyone, I'm your dog. Welcome to part 2 of nose breathing, medically known as epistaxis. In this video, I'm going to focus on treatment of nose breathing. If you want to understand this video better, watch part 1 where I've discussed in depth about nose breathing, where the blood originates when you are nose breathing, types of nose breathing, and all the causes of nose breathing. If you like this video and benefit from it, hit the like button, share, comment below, and most important, subscribe. Most people have experienced nose bleeding at some point in their life. Nose bleeding is a very common problem among people, but it usually, most of the cases of nose bleeding are minor, hence do not require medical attention. I'll start by defining nose bleeding. Is bleeding from the nose. We have said medically it's known as epistaxis. Nose bleeding usually can come from the anterior nose and can also come from the posterior part of the nose. That is back of the nose. Anterior is the front of the nose. Your nose has very many blood vessels. Has a very rich supply of blood, and those blood vessels usually form an area, or they converge together. They meet up and form a network of blood vessels we call the retro area. The retro area is this area which I've circled in blue. What are you supposed to do when you are nose breathing? Number one is you sit down, then you lean forward, and never lean backward. This will ensure that blood is dripping to the front part of the nose and not to the backward. When the blood moves to the back part of the nose, it can result to two things. One, you can swallow it. If you swallow it, you might experience nausea and vomiting. Then it can obstruct the airway. Number two is you press the soft part of the nose, you punch it, then you apply pressure firmly for around 5 to 30 minutes. Also, 5 to 10 minutes is sufficient time. Number three, use your mouth to breathe deeply and in a relaxing fashion. Number four, you can stop pressing the nose and assess whether nose breathing has stopped. If it has not stopped, you can repeat pressing the nose for another 5 to 30 minutes, or you visit a hospital. Patients who have a problem with nose bleeding should avoid the following. One, avoid nose picking. Nose picking is extraction of mucus from the nose by inserting the fingers and swallowing that mucus or putting it into the mouth. Nose picking usually happens in children, so you can tell your child to avoid nose picking. Sometimes it's difficult to deter a child from nose picking, so what you can do is to trim the nails, the sharp nails, so that they might not injure the blood vessels in the nose. Two, avoid putting foreign substances into the nose. Foreign substances, we said it's a cause of nose bleeding. They can injure blood vessels within the nose. Three is avoiding taking hot food and spicy food. Number four, avoid hot showers. Number five, you can, in case you have medications like aspirin, if you are taking medications like aspirin, avoid them. And also medications like NSAIDs. NSAIDs are painkillers like brufen, diclofenac, pyroxicam, meloxicam, etc. If you are a patient who is using blood thinner medications, These are medications that are used in patients who have maybe stroke, ischemic stroke, or medications are used with people with DVT, and you have started nosebleeding. Talk to your doctor and see how the medications can be changed, or maybe the doses can be adjusted. Then you avoid the dry dry air. Dry air usually result into to the irritation of the nose. Dry cold air can be avoided by using wearing a mask, and also sometimes if it's a kid you can apply Vaseline inside the nose. This one will help in causing that irritation to the nose. Also avoid alcohol, smoking, and also avoid taking rat poison. Rat can cause bleeding everywhere in the body, and also it can cause nose bleeding. If you're using if you have a high blood pressure or hypertension is a cause of nose bleeding, especially when the blood pressure exceeds 180 over 110. Make sure you visit a hospital and see how your blood pressure can be dropped in a systemic way. Then, if nose bleeding is severe nose bleeding can be treated by one. There is what we call nasal packing. Nasal packing is inserting a substance or petroleum gauze, or there are newer products that are used in the market nowadays. You insert those products into the nose. Those products will impart or create pressure to these blood vessels, and these will stop bleeding. Then we have a procedure which we call cauterization. Cauterization is damaging a blood vessel with either hot or cold equipment or a chemical. This blood vessel, when it's damaged, it's like burning that blood vessel so that it can stop bleeding. Then, if someone or you have infections of upper respiratory, like sinusitis and other bacterial infections of the nose, use antibiotics. Then, if bleeding is so severe, or it's from the posterior part of the nose, there's a procedure we call embolization. Embolization is using of particles to block an injured blood vessel. For more details, I'm Mohenya Doc. You can subscribe to my channel, and you can put a comment. Thank you.